Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed in detail about machinery, equipment and linen, we've also discussed about the care of linen, the care of rubber as well as of the steel items. In today's session, we are going to discuss about the care of glass, plastic, furniture and of the machinery equipment. So in a hospital, there are different articles, different equipments which we use in order to provide care for the patient, right? So these equipments, these articles may sometimes be made up of rubber, it may be made up of glass, it may be made up of plastic and even of steel. So how we will be able to take care of these items? There are different ways, there are different methods through which we can take care of each of the items, through which we can clean, we can sterilize each and every item. So talking about the glass equipment, as we know that any article which is made up of glass is very fragile, right? So here whenever we use any article which is made up of glass, we should make sure that we give special care whenever we handle them so that it do not break. So in a hospital, there are a list of glass items which we will be using in order to collect the specimen, in order to provide treatment or to know the baseline data of the client. It can be the test tube, it can be the funnel, it can be the slide, the specimen bottle, the thermometer, the ounce glass, or even the jar. So here, as I've said that in a hospital, there are various articles which will be present, which will be made up of glass, right? So how will you be able to clean or to take care of these articles? So whenever you need to clean these glass items, the first thing you need to do is that you need to immerse this used glass item in 5% chlorine for at least 5 minutes. And when you do this, you need to make sure that you do it in a container covered with a lid. So this is what we do when we need to disinfect the glass item. However, we can also wash the glass item by using a mild soap. And we can also use a plastic brush in order to clean the jars or tubes. Whereas the Nelson inhaler, the client's utensil as well as the pistol can be cleaned with the use of a soapy solution. So this is how you can clean the glass items. However, if that particular glass item is soiled or very much contaminated and it cannot be cleaned, then you must make sure that you discard it in a yellow bag. Moving on to the second one, that is the care of the plastic items. Any item which is made up of polyvinyl chloride are known as the plastic item. So since these plastic items are heat sensitive, whenever you clean this item, you need to make sure that they should be protected from light and even from radiations. So here are some examples of the plastic items which we use in the hospital include the basin, the bowl, the kidney tray, bedpan, syringe, area connector, and even the oxygen hood. So what are the steps that you need to do in order to clean these plastic items? The first thing is that you should make sure that the content which will be present in these plastic item should not stand for a long duration of time. So what you need to do is that the first thing is you need to empty or you need to discard the content which will be present in these plastic items, which can be in the kidney tray or in the bedpan. You must first discard the content in the appropriate area. Then you can rinse it in the cold running water, and after this is done, you can wash it in the warm water by the use of the soap and a brush in order to disinfect them. And after this is done, then you can soak them in Lysol solution of 1:4 ratio for at least an hour. And also these items can also be placed under the direct sunlight for few hours. So since these items are made up of plastic, right? So these are the various things we can do in order to disinfect or in order to clean the plastic items. Now moving on to the next, that is the furniture. A furniture is a movable article in a room which is established to fit for living or even for working. So here in the hospital, there are various furniture that you will see around. Okay, for example, we can say the bed in which the client will be laying, the trolley, and even the ward furniture, right? So here these furniture are usually of two types. The first one is the wooden furniture and the second one is the metal furniture. So what are these wooden furniture? These wooden furniture are the ones which is made up of wood. So this can include the tables, the chair, the hospital bed, the cupboard, the locker, the stool, the sofa as well as the bench. Whereas these metal furniture are commonly made up of iron or steel, and this can also include the bed, the trolley, the wheelchair, the locker, the dressing table or the dressing trolley, the OT table, the treatment table, the IV stand, the basin, the bed cradle, the backrest, the screen, the oxygen cylinder, and so on. So here the furniture will also be present in the hospital setting, right? However, these furniture are of two types. Any furniture which is made up of wood falls under the wooden category or the wooden furniture, and any furniture which is made up of iron or steels falls under the metal furniture. So in order to keep the furniture clean, what we must do is that we must first make sure that we prevent it from cross infection and also that we prolong the life of the furniture. That is why we say that care and maintenance of the furniture is very, very important. So now we will be discussing about few of the important points for the care and maintenance of the furniture which is present in the hospital. So the first point states that we must always keep the furniture free from dust. And how can we do this? We can do this by cleaning it with a piece of dry, clean and a soft cloth. We must also make sure that we wipe off any water which we have spilled on the furniture of the hospital, because in this manner it can also damage polish and the painted surface. And we must also make sure that we follow the rules and regulation, or we can say the hospital policies, for the cleaning and disinfection of the furniture. For example, the metallic furniture can be disinfected with the use of 2% glutaraldehyde, and also 2% of Savlon can be used in order to clean and disinfect the furniture. So depending on the hospital policy, or we can say depending on the rules and regulation which one hospital is following, we can clean and disinfect the items in that manner. And also here the trolley table, the IV stand and also the examination and the treatment table must be disinfected daily, or after the client has been discharged or after the death of that particular client. The hospital beds as well as the hospital lockers must be cleaned daily. And whenever you clean any furniture which is made up of iron, or we can say the steel furniture, we must make sure that we clean it by using a dry duster. So here as a nurse, it is very important that you must handle the whole furniture which is present in the hospital with utmost care. You should also teach your fellow staff members of how to clean and to maintain the furniture. You must also make sure that you do not keep any eatables in the furniture, or you do not cover the furniture with the use of a newspaper. Why? Because if you do this, then it gives an invitation for the cockroaches and also the rodents. So here, if you have to clean any furniture which is washable, then you can clean it with the use of a soap and water and then dry and disinfect it. Whereas there are certain items such as bed, such as trolley, such as wheelchair, which may need oil or grease for lubrication. So here it is very, very important that you should know how you can care and how you can maintain the furniture. And while doing this, if you find that there is any furniture which is being damaged, then you must make sure that you send them for repairing. And also here, repairing of furniture must be done timely. And also as a nurse, you must make sure that the stock register of the furniture must be up to date and it must be maintained. And for the condemnization of the furniture, that particular hospital must have a condemnization committee. So here, why do we try our best to maintain the furniture. We maintain the furniture. And why do we maintain this furniture? As we know that furniture is one of the item which is present in the hospital, which is very useful. Why? Because here the bed, the trolley, the wheelchair, it can be reused, and it can be given right from one patient to the other. So that is why maintenance of furniture is very important in order to preserve its maximum usefulness. Not only that, but if there is a clean and a stain-free furniture, then it enhances and give the aesthetic sense to the client. As well as cleaning of furniture in the hospital is very important because it prevents from cross-infection, and it also helps in prolonging the life of the furniture. Not only that, but it also provides a favorable environment for the recovery of the client. Here it's very understandable, right? If the furniture which we are using is clean, is stain free, it looks neat, it enhances and gives us an aesthetic look, as well as it provides a favorable condition for the recovery of the client. Then moving on to the next one, that is the machinery equipment. So here, any item which uses an electric current falls under this category. So this can include the suction apparatus, the defibrillator, the nebulizer machine, the refrigerator, the monitor, the ventilation, as well as the pulse oximeter. So here, how can you maintain these items? The first thing is that you should make sure that you do not on the power of these items when they are not in use. You must make sure that you wear your gloves and you separate all the tubings and dip it in a chemical disinfectant for at least 10 minutes. And after this has been done, then with the use of the soapy water, we can again clean the tubing and then rinse it in a clean water. We must also clean the jar with soap and water, and we must make sure that we discard the residual matter into sewage. And then after this has been done, then we can also dry and wrap them in a cloth and send them for autoclaving. And if we talk about certain machines which has a wheel, then oil and grease can be used or can be applied to the wheel as it is required. And when we talk about suction machine, then we should make sure that we clean each and every part of the suction machine with a cloth that contains a disinfectant. And here, in case if the jar which contained the content is very harmful, which means it contains some secretions that can be harmful, such as secretions from a client who's suffering from tuberculosis, then we must make sure that we discontaminate it before we discard it into the sewage. And if any machine which we use for the client contains any tubing, then we must make sure that we change the tubing after every 24 hours. And here, before you even perform this suctioning, you must make sure that you have already assessed the working condition of the suction machine, so that this suction machine would be in a proper working condition. And also, it's very important that we must always empty the jar daily, irrespective of how much content will be present in the jar. We must make sure that we do not wait, but we empty it on a daily basis. And the last one is the care of the refrigerator. So here you might have also seen that there is a refrigerator which will be present in the hospital, right? So the way we clean the refrigerator which is present at home, the same way we also clean this refrigerator which is present in the hospital. So this refrigerator which is present in the hospital, we must make sure that we at least empty and clean it twice a month. And here, if the refrigerator gets soiled, then we must make sure that we clean it immediately. We must also make sure that we discard any blood sample which has not been sent, any expired blood products, or even the open medications in case if the client for whom that medication needs to be given is already discharged. And as we know that these refrigerators are not used for keeping eatables, right? So we must never keep any eatables in this refrigerator containing the pathological products. Why? Because eatables provide conductive environment for the growth of microorganisms. That is why. And also, since these refrigerators are meant for storing the samples of the client or for storing the medications of the client, we should make sure that we must not place any eatables in it. And whenever you place any of the client sample in the refrigerator, you must make sure that that particular sample is labeled with their name, their age, and their gender. And most importantly, before we place any medication or any sample in the refrigerator, we must make sure that that particular refrigerator is in a good working condition. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session. Until then, have a good day. Thank you.